back. You're with us here on Leaders of Tomorrow, and tonight we're focusing on iKure. What do you do if you fall sick and are in a remote village of Kolkata? Simple. You look for a medical center by iKure using telemedicine to ensure that the rural population has access to good quality and affordable healthcare. Is iKure? Karishma Manjani has more on the story. For every 1,800 villagers, India has just one doctor. There's an ever-widening gap between the supply and demand of rural healthcare. Now coming to the rescue by providing affordable and accessible medical services using effective technology is the revolutionary startup iKure. Sujaya, thanks for talking to us on Leaders of Tomorrow. So we have healthcare centers across many villages of India, and they're pretty much driven by village women that are trained by your startup.
Yes.
So how are you relying on them? How are you training them to be a medium between the patients and the doctors in the metro cities?
So we have understood that these community health workers, they are actually the village women who are trained by us, and they are given smartphone loaded with our application and medic bags that has various innovative point of care devices such as BP instrument, ECG device, hemoglobin testing device. And what they do is when they go to the doorstep of these patients, they are able to capture all the vitals of these patients, feed this entire data on our application, and when they come within the internet zone, this whole data gets synchronized back to the cloud, and that is made available to the doctors. So with this, the doctors are able to go to the remotest parts through these health workers, even across the river where without any bridge, or through the hills in the jungles. They are able to reach to these patients' households to provide the effective care.
So out here we're talking about inclusion of technology to make sure that the healthcare facilities are reaching the remotest villages of India.
Yes.
And you're training the workers out here, village women out here. What's the cost of training?
The cost of training is very nominal, wherein it's the basic living, the day-to-day expenses during the training of 2 months, and then the cost is very nominal, wherein we are able to train these health workers.
So what are the services that are offered by these healthcare centers?
We work on this hub and spoke model. So in these hubs we have, it's a physical space of 600 to 800 or 1,000 square feet of space, where we have physical doctors, pathology services, telemedicine services, eye services, and then we have the mobile medical team which goes deeper into the pockets, let's say on the designated place in a designated day and time, let's say Mondays morning 9 a.m. to 12 noon, Wednesdays morning 9 a.m. to 12 noon. At the spokes, these villages who are coming from the surrounding 4 to 5 villages, they are able to get physical doctor consultations, medicines, various tests being done, eye checkup, computerized eye checkup, and in case they need additional services, they can come to the hub, which is at a maximum distance of 20 to 25 kilometers to do the pathology test and other services. So these community members, they are able to get all the basic services closer to the communities, and if they need advanced services, they can come to the hub.
So Sujay, the cadre of trained workers out here are equipped with a proprietary software called VIMS.
Yes.
Now talk to us about this software. What does the software really do, and what are its features?
Well, we started iKure in 2010. In the beginning of first 2.5 years, 3 years, we were a pure technology company wherein we developed our own proprietary software called VIMS with a whole idea of linking the patients with the doctors. Mostly what we see around is, let's say in the hospitals, when a patient is walking in, all the patient registration billing happens, and when the patient walks out of the hospital, the patient loses all contact with the doctors. At iKure, we have developed these WIMS which is centered around these patients. Right from the last mile, meaning at the doorstep of the patient, even wherever it could be, across the river, without any bridge, or through the hills in the jungles. If the patient is coming at the spokes, at the hubs, or even at the hospital, and again going back, we would be able to monitor that with our software. So WIMS has the features of, let's say, at the doorstep, we have the community health workers who are going. They are able to capture all the vitals of the patients. They are able to capture all the prescription related data, and that is made available to the doctors. So now the doctors, let's say, they have all the details. They might have gone to and seen the patient 2 weeks back, and then they say, okay, nothing to worry, change the drug, change the dosage, or bring the patient to me. So through these mechanisms, with the limited set of doctors and these community health workers, we are using this technology to bridge this gap.
iKure has adapted communication as an approach to mobilize the rural communities on social and cultural aspects. The healthcare workers target social taboos through interactions and street plays that spread the message of health and hygiene to individuals in far-flung areas. Let me run back up to the hub and spoke model that you mentioned here. iKure adopted this model 3 years back, and it is only applicable to certain geographies. Talk to our viewers on how you select which geography should work around the hub and spoke model, and talk to our viewers about the hub and spoke model.
Well, we understand that India is very diverse in nature. Each of the geographies, each of the terrains has different kinds of disease profile, people, livelihood patterns and everything. So we have kept this whole model very, very flexible and fluid in nature. So we understand that we specifically target the low income states which has low infrastructural issues. For example, West Bengal, Jharkhand, Orissa, Uttar Pradesh, Karnataka, and now we are also expanding in Madhya Pradesh, Rajasthan. So these, and also northeastern part. These are our focus states where we believe that hub and spoke models is the way to go. In the other areas, we are also very open to use our technology. For example, we are also working in close coordination with various state and the central governments to provide our technology to integrate the primary healthcare facilities.
So the cost of training the healthcare workers, the integration of technology, the health cards and the other systems, they are all coming at a cost. How are you offsetting these costs? What is a steady revenue stream?
Well, in case of iKure, for example, in our hub and spoke model, our health cards, they cost 600 rupees per family per year, which acts like a pre-insurance card mechanism wherein we are actually telling the patients to move from a curative approach to a preventive approach. So now with these health cards, we are able to earn a revenue. On top of that, for every transaction, let's say they come for doctor checkup, they go for spectacles, they buy medicines, they go for pathology setup, there are services and they pay for these, which are around 30 to 40% cheaper than the market rates. Apart from that, we also provide and sell our technology to various corporates, NGOs and the governments. And not only in India, we are also providing technology in Southeast Asia, in East Africa, and now we are also looking at Latin American markets. And apart from that, we have also built a robust platform wherein we are working with global leaders such as MIT, University of Michigan, University of Dalberg to come up with various comprehensive next-gen solutions. And as part of that partnership models, also we earn revenues.
iKure has now been recognized as one of the few startups that is profitable in the healthcare ecosystem. Talk to our entrepreneurs, give them one advice on how they can be profitable, how they can sustain if they are a social enterprise.
Well, just to my budding entrepreneurs out there, you really need to focus on unit economics, meaning that on per transaction, are you able to make money or lose money? So that's the real core thing. So at iKure, we have really focused on each and every transaction and whether these transactions are able to make money for iKure. And this is again a marathon. Running a startup is not like just a few months or 1 to 2 years of activity. You really need to be staying in the game, come what may, what kind of challenges are there, because no matter what, if you really are staying on the wicket, you definitely would be able to be successful.
So what are the future plans of iKure? What is the growth chart looking like?
So at iKure, what we have been able to do, we have been able to create a comprehensive primary healthcare model, and with our plan is to set up hundreds of primary healthcare facilities in India wherever there is a demand. So at iKure, we want to become the voice of public healthcare in the next coming year.
So Jaya, thanks for talking to us on Leaders of Tomorrow. Completely out of time in this episode of Leaders of Tomorrow. If you have any questions for us, you can always email us at leadersoftomorrow@timesgroup.com. On social media, tweet at me at Sunanda_J or LOT_ET now. You can also reach us on our Facebook page, Leaders of Tomorrow on ET now. Completely out of time. Thank you so much for watching.